This is Chris Steinbach. I'm the Deputy Director at Muscatine Center for Social Action, and I'm here with Maggie Curry, our Executive Director, and we are joined by Dr. Peter Korpi of the Family Eye and Contact Lens Center in Muscatine, who is the volunteer coordinator, I think would be the right thing to call you, for the MCSA Vision Clinic. Thank you for joining us this morning.
Thanks. Happy to be here.
First of all, did I get the title right? Is that how we should refer to you?
I'm not sure I had a title, but
That's good.
It's fine.
He does a lot of that.
Well, we were visiting before we started the interview, and how long has the Vision Clinic been a part of MCSA?
I believe it started in January of 2009. In 2008, we had done kind of a trial run with patients, but saw them in our office just to try to assess the need in the community and whether a clinic was needed. But we actually started the clinic, I think, in January 2009.
I'd like to say I remember the day that Pete came into the office, and he wanted to come in. He had a service he wanted to offer to people in need, and it just fit right in, because when you don't have your vision, it's very difficult to move ahead in life and things. And so it's just a wonderful service that he's doing for us, and we really appreciate it. A lot of people do.
Yeah, and there was certainly, I felt, a gap in the coverage that insurance provides and the state of Iowa provides for people of certain income levels. But then there was this kind of gap of people who may have a job but just don't have enough money or insurance coverage to cover the glasses end of things, because oftentimes that's kind of the last thing on the list.
And so that was sort of the motivation for doing this in the first place?
Right.
Okay. How did you get it started? I mean, how did it all come about? Where did the equipment come from? How much money did you have to raise?
When I initially came in and talked to Maggie and Sister Irma, who was the director at the time, we weren't quite sure what the need was, and so we weren't sure about the number of people. But Muscatine is very blessed to have an organization and people that support things like the Muscatine Health Support Foundation. Ask for ideas or requests every year for different projects, and we felt that this would qualify. Certain we had needed to have one room of equipment, one exam lane of equipment. I think if I'm remembering correctly, it was around $33,000 that we needed to come up with to equip the room with just kind of basic equipment and to get us going. So we made an application through the Muscatine Health Support Foundation for that.
It's a wonderful clinic. It's up to date. It's new technology and things. One thing also, Pete, is the frames and things. Where do you get those?
Well, it's nice because frames, as anyone who wears glasses knows, can be very expensive, and that's it's a big part of it. And so I contacted vendors that we use in our office and asked them for some type of support. So I wrote letters and emails to a number of different companies, and there was one particular company, Charmant is the name of it, who really came forward and said, okay, we like the idea of this project and we want to support it. And initially I think they sent 2,000 frames.
I remember seeing an email from you earlier this summer or this fall sometime that you had just received another shipment of frames too. Is that correct? Or
right? Yeah.
And from the same, was it from the same supplier? Or
that was a different supplier. It was actually a lens supplier that said, "Oh, we know that you do this type of work, and we have these frames that we don't know what to do with, and you want them." And so they sent, I think, 3,500 frames. So it's just kind
I'll keep you here for a while.
Yeah, it's great. I mean, I just think it really helps.
So how does the whole thing work? If I'm listening to this and I need to get my eyes checked and get a pair of glasses, can I just come to you, and how does it work? Walk me through the whole process.
I'm going to defer that to Maggie.
Thank you. Okay, I can do that. What it is, folks need to be referred from Muscatine County adults and referred from Community Action, Muscatine County Community Services, Department of Human Services. MCSA can do referrals. The Homeless Prevention Program does referrals, and also the Domestic Violence Shelter does referrals too. They come in with their referral, and they have to have their paperwork with them. And then what we do, there is a $10 fee. And the $10 fee needs to be paid before we'll schedule an appointment form. And that really, really helps in the no-shows, because when you put a little investment into that, you're going to be sure and go to your appointment. And then they come in and we schedule an appointment with Dr. Korpi with them, have all the paperwork here, and he comes in and he has an assistant that comes with him and has their paperwork. For the $10, they get an eye exam, they get frames, and if there's any medically issues, then he will refer them to the university, I believe.
Right.
Yeah. Okay.
Are there income requirements for this?
Yes.
So the agencies that are making the referrals are
We'll
checking all
qualify
that.
them. They'll qualify them. That's why they bring their paperwork in, and then we'll.
And it's for only Muscatine County residents, and they've got to be 18 or older. And the reason for that, as I understand it, is that there are other programs where children can get their eyes checked and get glasses if they need
Right.
them.
Yep.
So you got the $33,000 to get this started 5 years ago. There's got to be some expense in buying the lenses and that kind of stuff. Where does the money come from every year since you started to keep things going?
Well, part of it is, like Maggie said, the $10 fee that covers part of it. The other part is vendors that make lenses for us also have been very gracious in offering the highest discount that's available. So it's kind of like if I ran a chain of optical places of 200 stores, I get that kind of discount, and which is very helpful. So that keeps that cost low, and also there's support from like Muscatine Charities has been very gracious supporting this project. So.
And donations, people come in and want to make donations to it if they feel it's a worthy service.
How much of your time do you donate to this?
Well, in the past year, it's kind of like I do a day a month, but I try to know what I periodically try to call and see if there's a waiting list of people waiting for eye exams, and I try not to have people wait longer than a month. So if I need to be down here a couple of days, we schedule that. So it's kind of based on how many people are waiting. So.
I know from checking the records that in 2013 you examined 56 people, I think. And I checked this morning, and this does not include anybody that you may have examined this month, but so far this year you had examined 44 people. Does that sound about right?
It could be. Yeah, I don't keep exact track, but that's right.
And of the 44 people this year, I think 38 of them got a pair of glasses.
Probably,
Right.
yeah.
Adults, particularly about adults above 40, typically need glasses for something. I mean, that's just the way life is. So.
About the time they have to start going like this.
Yeah, when their arms get too short.
length and-
Yep, that's right. Yeah, then they show up. And oftentimes it identifies other issues too. From examining eyes, sometimes we'll see people that need further medical care, either for diabetes or hypertension or other issues. So.
And this is just something that how long do you think you'll keep doing this? Is this something that, what motivates you to do this? I mean, obviously you could spend that one day a month doing a lot of other things if you really wanted to, so why do you do this?
Well, I mean, I think God has blessed me with, certainly, parents who encourage education, a wife that supports any crazy idea I have, and a community that supports things like this. So I just think as long as I'm physically and mentally able to keep going, I'd like to keep going. So, hopefully people will come alongside, or I find others, so that the program continues even after I'm not physically or mentally able to do it. So I'm hoping this is a long-term deal for the Muscatine County.
Now, in the past, there have been other optometrists in town who also volunteered some time
Sure.
and worked with this. I don't think at the moment there are.
Not any currently. Dr. Berkey, who used to be at Vision Center, helped. Dr. Kruger from Walmart has helped. So,
Is there enough work there that if one of your colleagues in town somewhere would happen to hear this, is there enough need that you could really use some help?
well, sure.
doing
I would
this, or-
always welcome help, because I just think another person adds new ideas and enthusiasm and more opportunities for people. I always look at ways to, I want to make sure everyone's served that wants to be served. So there's always like I said, I would always welcome the help. Anybody who wanted to help for any amount of time, you know, one day a year, anything is good. So
In the 5 years that you've done this, I think it'd be roughly 5. Is there a patient or a particular situation that really stands out that you remember? Somebody that you were able to help, maybe even above and beyond what you normally would do, or?
well, the patient that comes to mind when you say that, and I haven't given this more than 2 seconds thought, but the one that jumps in my mind, it was the very first patient that I had when the clinic opened. He was waiting, I think, a half hour before we even got here. I mean, he was so anxious and he needed it so badly. His prescription was so high, and it made such a difference in just how he can go through his daily life that, yeah, I just think, yeah, that's why I do this. I mean, it's just an amazing feeling to be able to help somebody in that way. When somebody has a need for glasses, and without them they can't function, they can't drive, they have difficulty getting a job or even filling out a job application. To be able to provide them that aspect of it is just, yeah, it's crucial.
If I can add in, I remember one gentleman from the men's dorm, after he was examined and received his glasses, he was just so happy because he could read the recipe books and the cookbooks, and he was able to make the meals. He had been doing the meals, and he wasn't quite sure, but he said, you know, I guessed here and guessed there. But once he got his glasses and he was able to see the numbers and, you know, the recipe and stuff, he was just so proud of himself. And I think the guys upstairs enjoyed that too, because they knew he had more ingredients there than what he needed for what he had to do. But that's just, you know, to see people so appreciative and thankful, and your vision is so important, and I don't have to tell anybody that, you know, it's just really a big thing, major.
Yeah, and people have a tendency to take it for granted if it's easily accessed, and they don't think about it. But if it's hard to get and you don't have glasses, and I've certainly seen a number of patients, they come in, they're wearing glasses, and I'm saying, when did you get those? And they say, well, these are my neighbors, or these are my sisters, or these are, you know, they're not even theirs.
Yeah.
And they're trying to get something that's better than nothing. And so.
Well, anybody who knows me well would know that I've worn glasses or contact lenses for 40 years or more, practically. And I'm about as nearsighted as you can get. So I certainly can sympathize with anybody in that position. I wouldn't be able to function without it.
One thing I'd like to mention with Dr. Korpi, all the work he does outside of the community too. Do you mind touching on that, Pete, and the other countries that you go to?
Yeah, it's I've done a number of vision trips overseas. Currently, I'm working with a group called Vision Trust, and they, interestingly enough, don't have anything really to do with vision, but they operate schools and orphanages and after-school programs in 17 different countries. So the goal is to try to see every kid at every school. And so in the last 12, 14 months or so, we've seen 4,000 kids, and I've been to 6 different countries. And so, again, if my energy and resources last, we'll make it through. But I like to do other trips as they come up. You know, it's interesting, because when you start talking about it, people say, oh, I know this person who knows this person who has something in this country, and would you be willing to go there? Or would you be, and absolutely. I don't know where some of these things come from, but my ears are always open for opportunities and ways to help. And actually, after one of these trips, I came back, one of these overseas trips, and I had a patient in my office say, and this is before the MCSA clinic was open, well, why do you go so far away? Why don't you do stuff in Muscatine for people that need it? And I think that was probably the prompt to think, yeah, why don't I? So, and then that prompted me to come in and talk to Maggie and Sister Irma and get something set up, because, yeah, there's certainly needs everywhere, just certainly locally and overseas. So,
Well, we're certainly glad to have you here as part of MCSA.
Another thing that's really nice too, Pete was talking about the different frames that he receives. I remember years ago, you know, veterans or whoever, you go to the university and you have the choice of the black glasses or the gold glasses, and that was it. now they can try them on their name brand glove frames and stuff. They're just absolutely wonderful to stand there and be able to take 10 minutes and look and see what you really want to go with, and just builds up that self-esteem, which is really important, and makes people feel good, which is important.
Yeah, it's been wonderful. The support from all areas that make this happen is just, certainly a piece of this big puzzle with lots of players. So,
Well, thank you for joining us today. Is there anything else that we've not asked you that you'd like to say about this as we wrap things up?
I don't think so. I just feel very blessed to be part of it. I mean, I just think it's a wonderful thing.
We're very thankful too. It's been a great service.
Yes, we are. Thank you. That's been Dr. Peter Korpi with Maggie Curry and I, and we'll wrap this up and return to the studio.